Hi. Hi. Hey, I'm so glad everyone is joining me. I'm going to wait a little bit as more people log on and enter. So I love seeing the names here that I recognize. You guys are amazing. Wow, I have such sweet patients here. Thank you. Thank you guys. Some names I don't recognize. So yay. I am so glad you are all here today. And I'm so glad you all are here today. And I am really passionate about this topic. So I want to welcome you to this week's webinar. And I just want to go over some housekeeping rules at the top of this. So one thing to note is that you will be on mute during this time. Also, if you have any questions for me, please drop them into the Q&A, and there will be a time at the end of this discussion which I will address your questions. So also, if the internet goes down, please bear with us. We will get that back up and running hopefully within 5 to 10 minutes. So, all right. So again, welcome. I am Mary Scalf. I'm a physician assistant here at the MaxWell Clinic. I have been here for nearly 3 years. What you may not know about me is that I started my career in rheumatology. Rheumatology is a specialty largely dedicated to the treatment of autoimmune diseases, specifically like rheumatoid arthritis, lupus, psoriatic arthritis, just to name a few. Basically, if it involved inflammation and your joints hurting, I treated it. So it was there in that time that I began to wonder what was causing these issues, and not necessarily to only kind of name what was causing issues and not why. After I got good at naming what was causing issues and treating with appropriate medication, I was like, but why? Why do they have these? And that's largely what we ask in functional medicine. Why does this happen in someone's body? So while I had not had an autoimmune disease myself, I combated my own health challenges of chronic fatigue and anxiety with lifestyle changes by adapting to a paleo diet, CrossFit, and mountain biking. And I thought, couldn't this work for my patients? So usually what happens in a rheumatology office, you usually will get referred due to your symptoms of joint pain, fatigue, and maybe a positive lab test indicating autoimmunity. The rheumatologist will go over your symptoms in detail. They'll probably recheck a lot of labs, look for inflammation, and they'll feel on your joints. So once a condition is named, if you can be diagnosed with one, that would be a stopping point. That would be the time where the rheumatologist says, okay, this is what we have, let's start treatment. And many medications in rheumatology, as well as in autoimmune diseases, are all about suppressing anti this, anti that, block this, block that. So it doesn't really ask why, and it doesn't get to the root. It is just putting a Band-Aid, really. So all that to say, medications for autoimmune diseases have come a long way in the past several years to where they are really good at preventing disease progression, that help to resolve symptoms and to help improve functionality. So knowing this, my hope as I encountered some of the challenges I did was that maybe I could at least get some patients to reduce the amount of medications in their body and thus reduce other potential side effects and toxicities. So some of these medications suppress the immune system pretty heavily. These medications come with a laundry list of side effects that are scary, things that might increase liver toxicity, put you at risk for serious infections that could put you in the hospital, and also certain types of cancer. In these patients, I would see some improvement in their symptoms, and that was really rewarding. However, even if their symptoms were controlled on these disease-modifying agents or monoclonal antibodies, they were at risk for getting sick. So they had to be very vigilant to keep themselves well, to avoid any sickness. So on the flip side, in patients who were not responding to treatment, they were on not one, not two, but likely 3 or more medications to control their condition. And on top of that, they probably had other health issues like hypertension, high cholesterol, and they were on other medications. It was not uncommon that I would see people who had 10 medications on their pharmacy list. So at that point, I wondered, well, what are we really doing here? And if someone didn't have inflammation and their disease looked very in control, then if they still had pain, then it was like, well, here's a muscle relaxer to help with your pain. Here's something to help with nerve pain, like gabapentin, or you need an NSAID, like ibuprofen, or acetaminophen. So at some point, it was madness to me. Like, why? What are we doing with all these medications in the body? So as I saw more pharmaceuticals and patients that were not optimally well, I wondered if these medications were actually interacting with other medications they were taking and causing these side effects of fatigue, worsening pain, sleeplessness, depression. So basically, I felt I was creating a chemistry experiment in their body. It's not a good feeling because while all these medications have good data and studies behind them, they didn't study them in that patient's body. So at worst, when I would evaluate patients because of a positive lab, such as an ANA, anti-nuclear antibody, which tells me that the body is autoimmuning, I would get referrals from primary care doctors. And this was hard because I would get their symptoms, I would look at their hands, look at their exam and notice that they didn't have any joint swelling. They didn't have the signs of lupus in their body or rheumatoid arthritis. I could not diagnose them with a condition and therefore I could not help them. I don't like to see anybody suffering. Yet, like I knew these people weren't coming to the doctor just for fun. I know you don't come to see us just for fun. I know you have more things you'd rather do with your time and people you'd rather spend them with than me. So I wondered what else could help them, but I also wasn't trained to do that. For example, one of my first few days in this job, I was told that one of the mainstays in treatment for fibromyalgia was exercise, but that nobody wants to exercise. So that was the tone that was set in the beginning of my career. Because of my own experience, I knew there had to be a better way and more that I could offer patients to get better. I saw how good nutrition and consistent exercise resolved my own health issues, and I wonder if I had the time and the tools to teach my patients these things if they could be on a minimal amount of medications to control their conditions and also minimize side effects like those serious infections. I never truly dreamed that we could be off medications altogether, because if you go back 50 years, rheumatology offices were full with patients in wheelchairs. So I love working with patients with these autoimmune challenges. I geek out when I get a patient dealing with a rheumatic disease. I am truly passionate and I feel for you when you have this issue. So what is autoimmunity? I want to think about first what a healthy immune system looks like. Your healthy immune system is protecting you daily. It makes constant decisions between friend or foe as it encounters different infections, toxins, allergens, and stress. Our immune systems work so well that we don't even know they are working. So when we do come up on an immune challenge, some kind of sickness or allergen, we get these symptoms of fatigue or fever. We get like this mucus junk that we cough up. This is our immune system responding to that challenge. And the beautiful thing about our immune system is how smart it is. It learns from each challenge so it may better combat the next one until it doesn't. So autoimmunity occurs when your immune system kind of gets too good at this. It gets confused though, and it starts reacting to normal, healthy tissue in your body. It's like your immune system is an army protecting you, and it starts aiming towards the good guys instead of the actual perpetrators. And then as a result, your joints, your skin, your thyroid, your intestines, your liver, or your whole body suffers as a result. We can begin to find inflammation go up in your body in blood work. We can find a lot of different autoantibodies to reflect this. So when we look for these autoantibodies, yes, we can get a diagnosis, but also we like to think of that as your autoimmuning. We use it as a verb here. So what is causing that process? What is at the root of that autoimmunity? We like to think of it as immune dysregulation, that something in the process has broken down essentially. So what is at this cause of this autoimmunity? Usually deals with systemic inflammation. Inflammation is connected to all chronic disease, and the more inflammation we have chronically, the worse off we are. We want to address and drive down inflammation. So why is your immune system so upset? Why do you have this inflammation? And why is the conventional approach not working for you? Well, number one, they give you non-specific nutrition and exercise recommendations. It was not, let's just say that doctors, PAs, we are not taught in school about nutrition. We don't have an entire course dedicated to it. At best, we are told that the Mediterranean diet or the DASH diet can help improve cholesterol and blood pressure respectively. And that's it. That's a day. That's a lecture. So when you go to a doctor, and hopefully not at MaxWell Clinic, but outside of us, you're likely told, just eat better, exercise more. So what happens? You go home, you maybe think about it, you maybe forget about it. Maybe you think about it and you go online and you say, what is a good diet? And then you see, well, there is so much information that coconut oil is good for you. Coconut oil is bad for you. Don't eat the eggs. Eat the eggs. Red meat's the issue. What do you eat? And so it gets overwhelming and you're just like, forget that. I don't know where to start and I don't know if it'll work. And it's too hard. So your doctor likely doesn't have time to go over this, nor were they taught. So Dr. Ferris did a wonderful webinar a few weeks ago about food as medicine. I'm not going to belabor some of the points here because he really did a great presentation on that. So I do encourage you, if you haven't looked at that one, to go back to that. So at the root of this is our standard American diet, the acronym aptly as SAD. This is linked to inflammatory foods such as sugar, gluten, dairy. This is linked to processed foods, convenience foods, too many sugary drinks, and also what we lack in our diets, inadequate fiber. If you are my patient, you have heard me more than one time preach about fiber. I want you to get at least 25 grams of fiber in your diet a day. Fiber is it's more about decreasing inflammation, blood sugar regulation, as well as keeping you regular. Other benefits as well. You likely don't have enough omega-3s in your body relative to the omega-6 fatty acids. Most people get an omega-quant or omega check at our office to evaluate this. Omega-3s are important in our nutrition, and we don't usually eat enough fatty fish to help support that. So many of you are taking or should be taking an omega-3 to help decrease inflammation to better support your immune system. Vitamin D, most people are deficient in vitamin D. Vitamin D is important to support your immune system and to combat infection. Also, I find many are kind of depleted in B vitamins. One of the medications that rheumatic patients are placed on for arthritis is called methotrexate. The way that works is by kind of inhibiting folate metabolism. And I find people that are on folic acid, they still are not, they're not methylating that, therefore not getting the benefit. So they likely need a methylated form of folate to benefit them. Also, exercise more. Well, exercise is hard. It's hard to get started, and you have to find something you enjoy. Dr. Woods did a great webinar on exercise as medicine, and so I generally want my patients to find something they enjoy, something they can consistently do, trying to do up to 150, well, at least 150 minutes of exercise a week. So exercise can also, too little or too much, can cause inflammation. So we have a fine line to walk there. Number 2, your doctor likely does not consider allergens. And this is not just about environmental allergies, but I'm talking about food sensitivities. So when you start at MaxWell Clinic, we usually do this lab panel called the Big 7. The Big 7 looks at antibodies to food proteins from some of the most ubiquitous substances in our food. So these are gluten, dairy, corn, soy, peanut, egg, yeast. So I think that was 7. So these foods can help drive inflammation and also continue this feed-forward process of inflammation and autoimmunity. The more inflammation we have in the body, the more our immune system is having to work. So largely, this is why we will recommend an elimination diet for at least 3 to 4 weeks. We don't know what these antibodies will mean to you unless we get rid of them. And that way we can try to figure out what foods may be triggering some of your symptoms, some of that fatigue, some of the brain fog, the digestive issues, joint pain, inflammation. We also can do other testing if that's not kind of getting us to the root. You may need to look, before you remove gluten from your diet, you might need to do a celiac test. Also, gluten and dairy are some of the biggest contributors we find to these autoimmune conditions. Additionally, environmental allergens are important here as well. If you have bad seasonal allergies, and we have worked through improving them, and they're still not great, we need to consider doing allergy testing to do immunotherapy through allergy drops. What we are trying to do with this immune dysregulation is to decrease the overall load on your immune system so it functions better and more appropriately. This next topic is going to be a big one. So your doctor likely is not addressing stress. So at the very least, I could tell my patients if they flared up and they needed prednisone to help combat that flare, get their joint pain and inflammation under control. I knew that stress was a culprit there. However, did I coach my patients on how to address stress? No, I didn't. And telling somebody don't be stressed is not helpful. So stress on the body, it creates a downregulation of our immune response. Therefore, symptoms may flare up. Also may increase immune responses in the wrong direction, because also stress is going to contribute to inflammation. So I do recommend, if you did not see Emily Spring's Mind Body webinar last Friday, I do recommend checking that out. We have to balance our autonomic nervous system to be more in that rest and digest mode and not that fight or flight. We want to be processing foods well, nutrients. We want our bodies to know that everything's okay. I do also recommend many of my patients to meet with Emily for mind-body appointments. If you're interested in that, please ask your clinician. Emily does a wonderful job with that. Also, when you come in, we also do a heart rate variability, and this is to look at that autonomic nervous system, looking at that fight or flight mode versus the rest and digest. We can further dig into that with doing a first beat analysis. That is a 3-day monitor that you wear, and it looks at your kind of stress recovery components. And Dr. Ferris is really good at going over that with our patients. So shout out to one of my patients who had an excellent first beat report the other day. So there's also a lot of times where my patients will be like, I don't want to breathe. I don't want to do this meditation. I'm not stressed. And so I hear you on that. And I'm glad that you don't feel that. Like, the stress is more than just that overwhelming feeling that, how am I going to get all of this done? What am I going to do? Your body feels stress in other ways. And this stress can come from that allergen burden and why we want to do the elimination diet. This can come from toxins, which I'll get to in a little bit. But right now, I'm going to talk a little bit about chronic infections. So at some point in your journey, we will likely look into chronic underlying infections. We'll look at tick-borne illnesses. We'll look at different herpes viruses, one of which is Epstein-Barr. Epstein-Barr is a virus that causes mononucleosis. You may know this as the kissing disease. So if you look in the medical literature, you will see that Epstein-Barr virus is associated with 7 autoimmune diseases, including lupus, multiple sclerosis, rheumatoid arthritis, juvenile idiopathic arthritis, inflammatory bowel disease, celiac disease, and type 1 diabetes. So looking for Epstein-Barr is going to be important in this condition. Also, we want to know kind of what you're exposed to, or what's in your history, or what infections have you had. We might be able to dig further into those. On this panel that we do is usually a first look, and you may need further testing through infecto labs to see if you would benefit from an antibiotic. We always want to weigh out that risk versus benefit to know that the antibiotic will work for you versus the side effects you could have from that. Number 4, your doctor has no consideration for your poop. Well, unless you have an inflammatory bowel disease, they likely do. One of the rites of passage of MaxWell Clinic is doing a comprehensive stool analysis. I have many patients who never want to do that again. I don't blame you. So, but really, your poop tells us a lot, and it's really important that we look at it. Because if we're thinking about immune dysregulation and trying to regulate your immune system to improve its function, to have it not be confused, to know what's good is good and what's bad is bad, we have to look at your gut. Your gut contains nearly 70% of your immune system. That's a lot. Your gut also contains a reported 100 trillion of bacteria, good or bad, that make up your gut microbiome. Alterations that occur in this gut microbiome due to stress, due to allergens, intestinal permeability, aka leaky gut, medications you've used for pain like ibuprofen or naproxen, alcohol may contribute to alterations in your gut microbiome. And that was just to name a few. Alterations in this microbiome suppress your immune function. And with 70% of your immune function in your gut, we do not want that. Also, particular strains of bacteria have been correlated to autoimmune disease. So even if you are not having gastrointestinal symptoms and you are not really sure why your clinician wants to do a stool test, that's why. Your gut tells us more about kind of immune function than really about your poop, if that makes sense. So We want you to have a bowel movement every day because that's going to help with detox mechanisms that will support your immune function, but also how is the health of your gut? If you do not have enough beneficial bacteria like lactobacillus or bifidobacterium, that will set you up for these immune challenges. Lastly, I'm going to name environmental impacts that aren't considered usually. This list isn't comprehensive. There's likely more to go over, but I don't want to overwhelm with all the things. So your doctor likely doesn't consider environmental impacts. They will say, stop smoking. If you're a cigarette smoker, or if you've been a cigarette smoker, you are more likely to develop an autoimmune condition, namely rheumatoid arthritis. If you grew up around smoking and then became a smoker, you are twice as likely to develop rheumatoid arthritis than you were just being a smoker. Also, cigarette smoking causes inflammation. And so patients that continue to smoke while we're treating them with anti-inflammatories and immune suppressants were working against us. Like, do you want more medication? Do you want more potential side effects? So your doctor will tell you to stop smoking, but why is smoking put you at risk for autoimmune disease? So that comes back to toxins or heavy metals. Cigarette smoke usually is associated with an amount of cadmium that can cause some of this immune dysregulation and citrullinization of proteins associated with rheumatoid arthritis. While that cadmium may not be circulating in your blood, heavy metals get stuck in your tissues. So there are some considerations when we think about heavy metal testing that I'll talk about in a second. Other potential toxins may be someone who consumed a lot of tuna, a lot of sushi, had mercury fillings in their teeth for cavities. We want to look for mercury in your body. Want to think about, did you grow up around lead paint? Did you eat lead paint? Were you exposed to a lot of pesticides? Did you grow up beside a farm that used heavy pesticides? Were you exposed to mold? Could you have a mold toxicity? What about plastics in your body? BPA, phthalates, parabens can be connected to autoimmune diseases as well. So basically, we want to know, let your clinician know what you've been exposed to if this isn't an area we've dove into with you yet. The way we do this, we want to look for it in the blood first to see if you have a frank toxicity. If we see some things that are a little bit off, we will then want to do a provoked specimen, usually through your urine. And this will kind of tell us what all comes out and what gets pulled from your tissues to tell us kind of that burden and what's impacting your immune system, what's making your immune system angry, what is causing this confusion. So I want you to walk away from this. I don't want you to focus on, wow, I need to look at heavy metals first. I want you to master those lifestyle modifications first, that your nutrition is on point, that you're engaging in activity and physical exercise regularly, that you're addressing stress in other ways, taking time for those deep breaths or meditation or mindfulness activities that help to improve your resilience to stress and thus improve your immune function. When we're doing this well, I would continue looking at doing gut work, the stool test and intestinal barrier assessment. If that is looking great, then we're going to dive into those chronic infections, toxins, and hormones even. So this all is going to depend on your exposures, what we kind of dig into first. Again, this is going to be a conversation between you and your clinician. So What's really important when you have an autoimmune disease is to support your immune system as best it can, to dig into these underlying causes. We want to improve immune function and decrease the autoimmune signal, as 25% of patients with autoimmune disease tend to develop another autoimmune disease. Something that the National Institutes of Health put out recently is that they're noticing a climb in autoantibodies in our population. And I think that's largely due to environmental exposures. So those people don't have autoimmunity yet, but we need to think of that as an alarm that we want to address. We don't want to wait until symptoms start. Usually that was something that was hard being in rheumatology, is that, well, you have these thyroid antibodies that's possibly elevating this anti-nuclear antibody in your blood. So that's a false positive, and those antibodies may or may not mean anything. I have learned so much in my time in functional medicine, how that does mean something. And we have to be proactive in addressing these concerns and not reactive. Because once we start to be reactive, it is a lot more work to get better, unfortunately. Overall, I want you to know that if you deal with an autoimmune disease, you are not your autoimmune disease. You are an individual with meaning and purpose who is someone's mother or father, brother, sister, grandmother, grandfather, mother, father, friend, maybe something else I left out. You have passions. You were made for something. You just happen to also be dealing with an autoimmune challenge. And because you are a unique individual, there is no one-size-fits-all approach to autoimmunity like there is in conventional medicine. Again, conventional medicine is, okay, you have rheumatoid arthritis. Let's start you on prednisone. Let's check you back. Let's check your labs. Okay, you're not better. Let's start you on methotrexate. Well, let's see you in 3 months. Check your lab, check your symptoms. You move through an algorithm. Functional medicine, we don't do that. We consider each of you as one person, and we see your whole system and your whole body. And we continually ask, why, but why this? Why does your lab look like that? What is happening? Oh, why is it happening? So many times you might see my face kind of scrunch up, or maybe Emily's or Dr. Woods or Dr. Ferris, maybe even Dr. Hossie, but we're thinking, because the body is fascinating and we want to appreciate the whole of it and the individual, and not just divide you into certain subsects and send you off to all the different doctors, unless we do need another opinion. Okay, so with that, I will take some questions if you have any. I do have some. So, hey, well, hey, thank you for being here, everyone. So let's see, thank you. So I have, can you talk about MS also in relation to autoimmune and the eye inflammation uveitis, as well as the RH issues as well, and psoriatic arthritis? Thanks. All right, doctor. Are you speaking to RH factor in our blood? So in MS, there is a wonderful functional medicine doctor who has combated MS with largely incorporating an autoimmune protocol and a lot of organ meats into her diet. Uveitis can be used with some, again, these block this, block that drugs. And so you do really want to approach that due to what uveitis could lead to. So mainly what I would speak to is that likely to begin with, you need to be on these medications as we work on the underlying causes. And as we work on these underlying causes and we see improvement in symptoms and inflammation, we will need to work with your other doctor in order to taper off these medications. And I'm sorry, I don't know what you're referring to RH-wise. So if you would maybe send a message, I can get back and answer with you. Oh. RA. All right, is hormesis beneficial for people with autoimmune disease / hot cold exposure? Well, I am glad you asked that. So hot cold exposure, we know if you have not kind of looked into the Wim Hof method, there's cold exposure that is beneficial to improving our resiliency to stressors. And so we may see a benefit to immune function with incorporating those. So we also know, often with inflammatory joint pain, heat relieves these symptoms really well. It helps to relieve stiffness and the inflammation that is felt in the morning. And usually movement is when these patients feel best instead of being at rest. So, hi. The patient that wrote about psoriatic arthritis, MS, and RA, will you ask your question again? I'm trying to put it all together for you. Thank you for your appreciation and me giving this talk and discussion. I hope it's been informative and helpful, and hopefully it gives you hope and helps to explain why we do the investigations we do here. Again, a lot of this is to address the whole body. And so your immune system is more than just one part of your body. It's going to affect much more. So we have to improve immune function in order to combat autoimmunity. And we have to find out what is making the immune system mad that may produce this autoimmunity. And we need to take an all-around attack or all-around approach to best win this battle. And when you've talked to one person who's had success with one protocol, you have talked to one person who's had success with a certain protocol. And so it may work for many and it may not. And so that's the beautiful thing, is we try to do what's wise and what works, and we want results. So we never want to put you at harm or risk for any side effects due to treatment that can help you. How much does detoxing have an effect on autoimmunity, and how do we know what is the best type of detoxing to do? So our body is really great at doing detoxing. Our liver and our kidneys do a really good job at this on their own. So there's different approaches to think about detoxing. I kind of like shudder when I hear about people doing cleanses a little bit because they're a lot of gimmicky to a degree. So when we think about toxicities, we have to think about, where do we find that? Are we seeing challenges in your liver function? Are we seeing challenges in a lab called GGT that tells us about how well your liver's detoxing? So if we're seeing challenges there, we really want to support those mechanisms called phase 1 and phase 2 detox. There are certain foods that can support that. There's a detox food plan that we have to help support that through nutrition. Also, there are other kind of supplements we use to help support liver detox. Also, other things to support detox in your body. I talk a lot about consuming enough water, enough hydration every day, at least 60 to 80 ounces a day for most people. Those considerations for more water, we'll have to watch out if you have other conditions like heart failure. I also want to make sure that we don't dilute all of your electrolytes. So that's going to be one way to help with detox. Another is that you're sweating. So movement and exercise is another way to detox. So other than that, we really have to dig in to see where are those detox issues. If it's trying to get plastics out of your body, if it's trying to get heavy metals out of your body, that each kind of protocol is going to depend on what that challenge is. Do you find that people with underlying trauma are more susceptible to developing an autoimmune condition, and that by healing those past traumas, this can help reverse symptoms? Wow, that is a really good question. So underlying traumas can contribute to chronic conditions in general. So I find that when this trauma is addressed, that a lot of these issues can reverse symptoms. These issues that are addressed can reverse symptoms. So a lot of it is recognizing those issues exist and being able to do the work to address those traumas. So yeah. Okay. Do we have any other questions? I understand you're trying to ask a general question on MS, psoriatic arthritis, and uveitis in relationship to autoimmunity. I'm not really sure what the question is there. Yes, all of those are autoimmune conditions. And so what is going on in your body? What are your symptoms? What do we need to look at for diagnosis? That's kind of, please come see me. Any other questions? Can a person who takes a lot of prescriptions build up a lot of toxins that may cause inflammation? Wow, this is something that really got me started on this path of functional medicine, because a lot of these medications had similar side effects and had significant loads on the liver, as well as the immune system. So if we think about the immune system depression, if somebody's immune system dropped to lower numbers, it wasn't let's reduce this medication, it was let's add some prednisone to support their white blood cell count. If it was toxicity to the liver, inflammation of the liver, maybe it was too much Tylenol. Maybe it was too much ibuprofen. But also, yes, you can't accumulate these things. We know that medication can cause nutrient deficiencies. To each their own. We'd have to talk about them individually. But it's kind of hard to say. I'm glad you asked that because I want to talk about this. So there is a kind of lupus called drug-induced lupus. So yes, there are drugs that can cause autoimmune disease. Even like Guillain-Barré. Or another question. I have RA. I've had it for over 10 years. Oh my gosh, that is hard. I'm so sorry. I'm considering starting methotrexate because I'm getting deformities in my hands and ankles. Are there any other ways to prevent deformities from RA? Well, make sure that we have addressed all those causes. So methotrexate, I want to know that you're not a female of childbearing age. I would not want you to be on it due to potential effects to a fetus. I would want to make sure that we support liver detox, and I would want to make sure that you're on the right type of folate in your body, make sure that you don't have any methylation issues. So is there any other way to prevent joint deformities? Once a joint deformity happens, we cannot get it back. So methotrexate does a pretty good job at preventing joint deformities. However, the drugs that are better at this are going to be some of those scarier seeming ones, things like Humira, Enbrel, Remicade, and some other more targeted medications. Things like hydroxychloroquine and prednisone do not stop joint damage. So these drugs are really good at stopping joint damage progression. An old treatment for RA that had some benefit was gold. We do not offer that treatment, but I wonder if we could. So I would. I'm not your clinician, so I don't have another way to reduce that joint damage, and I would recommend doing some of these medications and doing the other work in the meantime to see if you can be on the minimal amount to help stop progression of this condition of your RA. Are you aware of an EBV test that actually tests for circulating virus in the blood versus just checking the antibodies? I understand there is a test for this, but cannot remember the name of it. So you can look at a PCR test, which actually is going to look for, is there DNA of this virus in your body? There's also, we can look through infecto labs to see what is the actual burden on the body. Is there activity of these T cells of your immune system causing this? So get back to me on that if you would like to order that for yourself, because that's one of my patients. So can I stop my Enbrel? No, I wouldn't. Here's some reasons. So when I was in rheumatology, I had a patient who was a chiropractor, and he literally used a similar drug called Humira just as needed. And I thought he was crazy because I didn't know what I didn't know, but he did. So he used this just as needed, and maybe once a month when it's indicated to do every couple weeks. And He was fine. He did good nutrition. He was active. He did CrossFit, and his psoriatic arthritis remained under control. So I always wonder again, what's the minimal amount we can do? If the medication is indicated to do every week or every other week, can we get it to once a month or every other month with everything else we're doing and still have benefit to where we maintain your joint function and you have a good quality of life? Okay, I believe that's all the questions I have. If there's any more, I'll leave just a little bit of time to get them in. Okay. Thank you so much for joining me and taking this time. I really enjoyed this. I am a geek about rheumatoid conditions. I really appreciate you guys being here with me and expressing your thankfulness for this time. Thank you so much. And I look forward to seeing you in the clinic and helping you all out. And if you're not my patient, your clinician will address these things with you. So I thank you so much and hope you have a great rest of your day.